Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Medicine Centre Pharmacy is part of a locally owned community pharmacy chain, providing compounding services, consultations and education to patients and providers in the state of Ohio. They compound LDN in a variety of dose forms and protocols to meet the needs of patients across a variety of disease states. For more information, call 330-339-4466 or visit www.medshoprx.com. Today my guest is Brad White, who is a second-generation pharmacist and co-owner and vice president of Medicine Centre Pharmacies in Canton, Ohio. Brad and his team have been dispensing LDN since 2014 and continue to do research and educate patients and providers in the field of compounding and LDN. Thank you for joining us today, Brad.
Thank you very much, Linda, for having me. It's a pleasure.
So, did you always want to be a pharmacist when you were a little boy?
Well, I think I did. I tell you what, I always was fascinated by medicine and how medications and doctors could help people get well. My father was a pharmacist. He started his first independent pharmacy in 1976. And even as a young boy, I was working in and around the pharmacy, and it started with sweeping parking lots and painting fences and things of that nature until I graduated to a pharmacy technician. And then I felt like I had such an inspiration to be part of helping people get well that it led me to pharmacy school and onto the journey where I ended up today.
Mm-hmm. So where did you study?
I took pharmacy school at Purdue University in West Lafayette, Indiana. And it was a wonderful facility that is very much ingrained in research and in growing young pharmacists and scientists. And it really helped me see that lifelong learning is an important opportunity, especially in the healthcare field, to be open-minded and willing to dig into new research and help people with their conditions that they're suffering with.
Mm-hmm. And did you start work straight away in your father's pharmacy when you qualified?
You know, I did. I had some experiences during my education at Purdue where we visited different institutions and medical facilities and pharmacies around Indiana and Ohio. But I did immediately come back to my family's company because I felt like it was my responsibility to help the patients in our community, because we had built a reputation of having a caring background and providing quality service to patients.
Mm-hmm. Okay. So you started compounding in 2014. Have your practices changed over that time? Have you evolved as a pharmacy?
You know, we did. We for years and years, for almost, we always were involved in compounding, but it wasn't until we joined PCCA in 2004 that we really became educated in what was possible to help patients solve problems that weren't available to be solved commercially. And that's when I really was inspired by some of the patients we were able to help. Both people and pets, for that matter. Mm-hmm. So one of the things that I think is most rewarding is being able to help people solve a problem when they've almost felt like they've run out of solutions or run out of options to try. And that's been really rewarding for me.
Mm-hmm. So when you first started compounding LDN, what would you say the norm was in those days of prescribing it, you know, the formulations, the dosing protocols? What were they back then?
Well, it's really interesting. My we were getting occasional prescriptions for low dose naltrexone, and it was the traditional 1.5, 3 milligram, and 4.5 milligram. So just those three doses from providers that were ordering for patients that had fibromyalgia and some pain issues, and it wasn't until I went to a seminar at Professional Compounding Centers of America in Chicago and was made aware of the exploding research and opportunities to help people across a wide variety of autoimmune conditions that I really began to talk to the patients closely and find out what different conditions they were dealing with. And it was fascinating to find out how much research was available. We come from, in our community, our small community, we had some patients that used our compounding services for their pets or maybe for hormone replacement. And we always had physicians that were a little leery of trying something different because there weren't research studies. But my goodness, with low-dose naltrexone, the research is plentiful. And it was really exciting to be able to educate patients and providers with the research that was out in the environment. And it really has helped us grow our educational basis and help provide patients and providers with tools to ask them questions about the therapies they're prescribing.
What forms do you compound LDN into?
We right now are compounding low-dose naltrexone into primarily oral and topical dosage forms. We started out, as you touched on, with really only 3 strengths, and now we're compounding almost, last I looked, I think we've made almost 23 different dosage forms on both oral capsules and some topical creams. Occasionally we'll do a liquid if there's a need for a patient that can't swallow a capsule. But it's amazing the different number of protocols that are out there now available for patients across a wide variety of conditions. So it's really exciting.
Exactly. What fillers do you use? Some people are very wary of different fillers.
Yes, that's a great question. We do not use lactose. Currently, we are primarily using a proprietary filler that PCCA has developed called Lux Oral. And it is an inert filler that is hypoallergenic and doesn't have any problems with allergies or reactions of that nature. So we try to make sure that our preparations are dye-free and allergen-free in every case, because generally patients seek us out for purposes of that very reason. They're sensitive to colors and dyes and fillers that can be inflammatory, and we certainly don't want to add anything that could be inflammatory, especially to LDN.
Mm-hmm. Okay. Patient testimonies. What would you say have been the amazing stories you've heard?
Recently, I have a couple favorites. One of my favorites is a young woman who was using LDN and found it because she had Hashimoto's thyroiditis and would go to work during the day and work all day and come home and collapse on the couch because she was exhausted. It was affecting her family life. She wasn't really there and able to be present for her young children as her husband was deployed at the time. And she was just stressed to the max and really at wit's end. She really relayed some inspiring stories to us at the point where she basically felt like she got her life back. And I can't tell you how powerful it is to hear that from a patient, feel like they've gotten their life back. So she currently is on a combination of LDN and Armour Thyroid right now to manage her condition. She looks great. She's always energetic when I see her in the pharmacy. I've had the luxury of having her visit some of our public education seminars to help share her story to our patients. And I recently found out that she's being deployed overseas for a military rotation in the next month. So she's obviously doing much better to the point where she feels like she's capable of continuing to serve her country and be part of her community. The other neat story that I just had last week was a patient who wanted to reach out about options for weight loss. And we currently work with the LDN RX Consultants Group with David Yazel and John Herr. And he shared with us a protocol for weight loss. And the patient touched base with me last Friday and has already told me she's lost 5 pounds. So she's thrilled. So it's kind of an interesting gamut of where LDN can be effective for patients, from chronic disease to, I don't want to say it's something as simple as weight loss, but something as frustrating as weight loss is a neat mix of conditions.
Mm-hmm. And what about pets? You said that you compound medications for animals.
We do compound medications for animals. A lot of different things come up. Probably our most popular are thyroid conditions for felines. We do have some medications that we prepare for anti-seizures for both dogs and cats. So those are probably the most common things. We haven't had a lot of opportunity yet for LDN, although I'm aware that there are some interesting studies going on in North Carolina with regard to tumor treatment for pets, canines specifically. So we're having some discussions with veterinarians in that area about possibilities and things that could be very interesting to add to their practice scope of treatment options.
Mm-hmm. And I imagine the topical cream lotions are geared towards children, are they? In your practice?
They can be, absolutely. Yeah, absolutely. Anything from, probably the first thing that comes to mind are patients that have psoriasis or eczema. I mean, topical creams could be great for that. Oral works great too, but not everybody is keen on swallowing a capsule. And based on our accreditation for our compounding laboratory, we have to be cognizant of USP guidelines. So sometimes liquid formulations for patients aren't always ideal because they don't last as long for an expiration date. So we try to give a patient a tool that is easy to use and affordable, but also is able to go the distance so they don't have to get more than one prescription refill a month.
Mm-hmm. And what is the base of your topical cream?
We like to use primarily a base from our supplier from PCCA. It is called Lipoderm. It is a hypoallergenic and a very nice consistency to help deliver medication through the skin. It rubs in nice and clean. It's not greasy, and it disappears well. So that is also gives us the luxury of having some extended expiration dates. So what we call a beyond use date. So if we can use a topical delivery method that does not contain water, we can have a longer expiration date. So therefore we can provide the patient with a volume that gives them a better value for their dollar because it will last longer.
Mm-hmm. Okay. So tell us more about what you're doing, what your plans are for the future. Where do you see LDN going?
Well, LDN has been really exciting for me to be a part of because in our community, we've had patients that come in that are really frustrated. We're much like your documentary that you've highlighted on the LDN Research Trust. Opioid epidemic in Ohio is a very big problem, and patients who are in pain and suffering have been really frustrated with treatment options for what they can do. So over the past 6 months, we have had monthly patient education and provider education seminars to try to make our patients and public aware of the studies that are out there for LDN and what's available to consider if we've tried traditional therapies and maybe aren't having the success they're looking for. So what I really see, at least in my community, is I see physicians who are now realizing that naltrexone isn't just for treating conditions of drug abuse and alcoholism, that its off-label uses can be just as valuable in patients for autoimmune conditions or chronic diseases and chronic pain. And it's something that's been very interesting because they've been able to see studies from people they respect. They go to these conventions and they know Dr. Chopra and they know of Dr. Bahari and they know of these well-renowned researchers who have put together studies that help them see that there's other opportunities out there, and they're able to build on their trust and talk to their patients and look for outcomes that they never expected before.
Mm-hmm. Well, that's the thing, isn't it, with people with pain, where you may have had an accident or, a car accident, or you've tripped and fallen and broken a bone or twisted something badly, and you're given strong painkillers over a period of time, and then you become addicted and you can't stop taking them, and then you have to keep increasing those medications to still get the same effect, and then you could end up having a cocktail of pain medications. I can remember speaking to Dr. Sami Devdatta, who's a pain specialist in New Jersey, and he was saying that he sometimes is called out to the hospital. This patient's pain is at a 10 and the hospital doesn't know what to do, and he says the first thing he does is get them to stop some of the medications, because he said if you have too many pain medications, they don't work. You can take too much. And as you've seen in the documentary, he was talking about weaning patients off of opioids who have been taking them for, say, 20 years by using ultra-low dose naltrexone. And the results have been amazing.
Yes.
And he wanted me to talk to some of his patients. So when I went in, I can't remember, I've been twice last year, he had patients there who were telling me their stories. So it wasn't just coming from his side, it was from the patient's side as well, where they were not living at all because of the pain. And now some of them, the stories were the pain was still there, but it was a low pain and it didn't stop them from functioning. They were just aware of it. It wasn't where it was like, oh, that hurts too much, I can't do that. And some of the other ones were just saying they're virtually pain-free. And that is so hard to comprehend, isn't it? When you are addicted to these drugs, to actually be able to get off them quite quickly and safely. And I always have to add that you have to do it under medical supervision. Please do not do it on your own. You could go into terrible withdrawal. But with a knowledgeable, it's a three-way thing, isn't it? You need a knowledgeable doctor, a knowledgeable pharmacist, and a patient that will listen and do what has been suggested.
I would totally agree, because I feel like we're all in this together, and our objective sometimes is to work within the boundaries of a healthcare system that has a certain set of standards available or in place that don't always have the patient's best interest at hand. So education's a powerful thing. I agree with you. It's one of those things that, there's so much information, especially with low-dose naltrexone, to keep up with. I mean, you almost need the skills of an educated researcher to help you realize which studies are valid, which studies you might look at with a little bit of scrutiny. But if we can pull all that together and educate the physicians and the pharmacists and the patient and the researcher and help us get everything tied up with a bow, we can share so much information that could have a huge impact on patients to help them feel better and get their life back. And I think that's what's so inspiring.
Mm-hmm. And do you know of any pain specialists that are prescribing low-dose naltrexone in Ohio?
We have several providers right now that are using low-dose naltrexone for success with patients across a number of different pain conditions. We are actively working with a couple prescribers at local pain clinics. I was really fortunate to have an opportunity about 2.5 weeks ago to speak to a pain management support group at the Cleveland Clinic and had a wonderful discussion with those patients who have been through the ringer, many of them, and trying to find solutions. So provider interest is out there. I think that there are some providers that are still a little scrupulous and are just trying to make sure that they're not going to hurt their patient. And, I think that as the education gap gets bridged, we're going to have more and more providers that look to low-dose naltrexone as the initial therapy and not as a therapy of last resort. And I think that'd be really great for patient care in our communities.
Definitely. It would then save weaning people off of the opioids if they weren't addicted to them in the first place.
Exactly.
And of course, I'll have you tell us in a moment, opioids are not side effect free, are they? They can also, long-term use can affect your organs, etc. Could you tell us a bit about that? What happens if you take opioids for a long period of time?
Absolutely. I mean, opioids can have a number of impacts on your body and your body chemistry. I mean, the first things that come to mind are that people are most frustrated with is their ability to be alert and cognitive. Any opioid medication could affect your ability to drive, to climb stairs. It could increase your fall risk. If you're taking other medications for depression or anxiety, all those side effects can be magnified and put you at risk for being safe. They cause constipation. That can be terribly uncomfortable. But long term, depending on the situation and the dose you're taking, you mentioned earlier in our discussion that your tolerance increases. So unfortunately, sometimes it takes more of a prescription medication to get the same effect, which that means your doses get higher and higher. Unfortunately, that means you have situations that could impact other medications in your body and the way they're metabolized. So I don't want anyone to suffer with pain, and I really hope that we can all work together to find solutions to control pain, whether it be through physical therapy or even just practicing good mental health habits with meditation or yoga or prayer or things that give you that release that aren't necessarily drug related. So there's a lot of things that can go on, but sometimes people have conditions that are just so frustrating they feel like they're trapped and don't have a way out. And I hope that nothing else that we can help people find other options through LDN and ULDN that will help them be able to live a life that will give them more reward and more quality without feeling like they're subject to the scrutiny of using an opioid medication and limiting their activities of daily living because of what those medications can impact.
Mm-hmm. And what are your favorite supplements that you suggest to your patients to take whilst on LDN?
On LDN, I have a core of supplements that I'm really fond of. I really like a good high-quality omega-3 fatty acid. There's a lot of neat options available today that are both fish-based or algae-based, depending on if you have allergies. I really like a quality multivitamin because our bodies need the basic nutrients to metabolize a number of different things on a daily basis. Magnesium is extremely important. It's responsible for over 400 chemical reactions in the body. And a quality product like a coenzyme Q10, I think, is important, as most of us, as we get older, all have some relative effect of health on our cardiovascular system and heart. So I think a nice mix of nutrition with quality health habits. LDN is a fabulous tool to help solve or address a number of problems, but you still have to remember you have to watch your diet, you have to practice healthy habits, you have to try to get some exercise as best you can. So it's not a magic bullet. It's a tool, but you got to practice a lot of healthy tools to make sure that all together they can work synergistically.
Mm-hmm. And what are your thoughts of CBD oil alongside of LDN for pain?
we have had an explosion of CBD interest in the state of Ohio since last August. Our particular state has been very slow to allow legal selling of that. But since then, my studies and patient interactions have been really interesting and exciting. I really have started to use our Dose Naltrexone educational seminars to add a component to CBD oil, since they can complement each other in such a fashion to help with different things like anxiety and depression and inflammation and pain. I think CBD at some point may become the second multivitamin, if you will, for patients for overall health. I'm really excited about its potentials. I'm continuing to actively try to learn more about it. The mechanism of actions are very interesting because they work a little bit differently than low-dose naltrexone, but they could be used together and complement situations where you could treat conditions like pain and anxiety or depression together and hopefully get a benefit from both that would be more synergistic than you'd get from either one by itself.
Mm-hmm. Exactly. We did have 2 lectures at the 2019 conference that talked about LDN and CBD together. I mean, you some people think that it's like taking marijuana, but the CBD that we're talking about is usually less than 0.3, is it percent
Correct.
of THC, which is the marijuana part of it. I'm not describing it very well, but it's not you're not gonna get high on it. It's not addictive, but it does work,
right,
as you said, synergistically with LDN. Together they provide a lot of relief for people, which is good.
That's been a big component of education. What you just touched on is people hear CBD and they automatically think medical marijuana. Mm-hmm. And you're right, it's not the case. You're not going to get high from CBD. It doesn't have that high THC, that psychoactive property in it. But you have over 100 different cannabinoids where you can get benefit on a number of different mechanisms and receptors in the body. It's fascinating chemistry, and I'm really disappointed that graduating from pharmacy even just 24 years ago, we got no information on CBD, no information on the endocannabinoid system. It's like a whole new opportunity of living in a moment where there's almost a renaissance of what could be possible to help give people additional treatment options.
Mm. I had one lady contact me last week, I believe, and she said that her doctor had prescribed LDN for her, and he had told her if it hadn't worked by week 3, she should stop because it's not going to work. Now, when I've interviewed doctors and asked when they're, how long does it take for LDN to work, which I mean is an open-ended question, but most of them said if pushed around the 4-month mark. Anything earlier than that, you've done really well. But we do know that some patients are really slow to respond. They may, if they have a progressive disease, have stopped that progression. And then 15 to 18 months later, they could then start getting symptom relief. That was the results of a survey we did many years ago. So, 3 weeks for a doctor to say to somebody, 3 weeks, that is really way too early. But what would you say a person needs to take CBD for before they would notice improvements? How long would you need to take it for?
It's interesting you frame it that way because I agree. Different people have responses in different time frames, some quicker than others. Mm-hmm. I generally, with a person, depending on the condition they're dealing with, what I'm seeing is let's say you were out in the yard over the weekend and you were cleaning up and trying to, maybe you overexerted yourself and you strained a muscle or you strained your back. People that use topical, like salves or ointments for CBD, generally seem to get some level of results pretty quickly. It could be within a couple hours or even over maybe a day or two. But when you're looking at more complex situations. I've seen situations that speak to your be patient and titrate slowly comments. Maybe it's anxiety that you have on a daily basis. Maybe it's rheumatoid arthritis. It seems like both patients in these groups we've had in our pharmacies that have had luck, but it's taken some time. Sometimes it takes 60 days. Sometimes it takes 90. It takes some messing with the dose because everybody's a little different. And I think that we have grown up in a society where we all want instant gratification and we want the solution now. And with CBD and even LDN, I think you've got to be a little bit trusting and a little bit patient and give it some time to work in the background. Because if you're taking something for a more chronic, more painful condition or a more an issue that is more exposed, it's probably going to take you longer than 30 to 60 days to get a significant benefit. Mm-hmm. Now, that being said, I had another patient last week who tells me that he's got terrible neuropathy, which is nerve pain in his feet. And he felt after the first week he had at least a 20% benefit. But I've encouraged him not to give up. And you mentioned earlier in our discussion that, maybe your pain score went from 10 to 5, which sometimes the people who don't have pain don't understand that that's a significant improvement, mm-hmm. even though pain didn't go away. So you've got to kind of continue to string it along and test your dose level and see if maybe it needs to go up or down. But I would encourage patients that have tried CBD or LDN and not had the success they hoped for to re-examine what dose they were on or what dosing schedule they were on, because both can be very important to the success of their condition.
Mm-hmm. Exactly. Well, we're just about to the end of the show, but I would like to say I was speaking to one pain specialist and he said to me, we are being very naive if we can think we can cure everybody's pain. That's not realistic. But what we should be able to do is make everybody's pain bearable. So I think that just brings it into perspective. But as you were saying, if your pain is on a 10 on a daily basis and it gets down to 3, 4 or even a 5, for that person, that is life-changing. If they're still able to continue with their daily life and the pain is there, but it's not stopping them, that's a big achievement, isn't it?
It is. It's huge. And it was a lesson taught to me that I would have thought, well, we got to get your pain to go away. Mm. And I'm thinking we'd all like to cure people's pain, no question. But you're right. I mean, that could be the difference from somebody playing with their grandchild in the backyard on a nice sunny day, or sitting in the house miserable, not being able to move. I mean, that it could be that significant.
Mm-hmm. Definitely. Well, thank you for being my guest today. It's been really interesting talking to you.
Well, I appreciate it, Linda. It's been a privilege and an honor to join your program, and I admire everything that you and the LDN Research Trust is striving to educate and accomplish. And it's exciting times with all the research available.
Well, thank you very much. Medicine Centre Pharmacy is part of a locally owned community pharmacy chain, providing compounding services, consultations and education to patients and providers in the state of Ohio. They compound LDN in a variety of dose forms and protocols to meet the needs of patients across a variety of disease states. For more information, call 330-339-4466 or visit www.medshoprx.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.